So Haroon, bro, you've been doing this like longer. You've actually been doing this longer than I've been alive, which is
Yeah.
which is crazy, right? So what made you get into this industry?
Well, myself, I started through martial arts
Yeah.
because I started martial arts at a very young age. And so by the time I was 16, the first time I came across any sort of manual therapy work was with one of my teachers was treating not a student, but a friend of a student's that could had some back injury.
Mm.
So I kind of took interest in it. And I was always like a kind of a sponge, wanted to soak up and learn everything. You know, you see your
Nice.
master, and there's like, because my master doing it, I'm doing it. So my
So did your teacher? Did he treat people with pain and stuff like
yeah,
that?
because a lot of the old traditional martial artists, they weren't just martial arts in the sense of fighters. A lot of them were healers because that came as part and parcel of your kind of your job remit. So if you look at old China, old Japan, old Vietnam, Philippines, a lot of the martial arts were also healers because you wouldn't have that. You wouldn't that would be your local doctor. So he'd be adapting, giving you herbs. He'd be adapting, doing manual therapy. Teachers was like this. So I was at 16 at that time. I started martial arts before that, but I was at 16 when I first saw this. And then when my teacher first started teaching something called Anma and Tuna. So that's basically the forerunners to like Shiatsu, the forerunners to acupuncture, acupressure.
Mm.
So I saw him teach that as a part of a course where he was teaching Qigong, Wild Goose Qigong, and also Tuna. But me being 16-year-old, when I was in there, we were teaching how to heal, but I was more
Yeah.
interested to learning how to hurt someone. And then he kind of sat me aside and said, look, this is all the people on this course here, they're not martial artists. We're not here to hurt anyone. We're here to heal.
Mm.
And so martial arts to be yin yang. Life is about negative, positive, you know. So and then I actually started taking quite enjoyment in it because I started learning it and started practicing on family and friends. So that was my initial kind of like an entry thing into like doing manual work. Then later on, I progressed onto doing different courses. So for example, one of the first ones I did was actually wet cupping. So kind of was one of the
Hijama.
hijama, yes, also known as hijama, yes, the Arabic word,
Yeah.
like from hijam meaning sucking or pulling.
Yeah.
So initially got involved in that. Me and my wife actually did. So and we were actually the first lot of group of people who did it in London,
London.
specifically East London.
You and your wife.
Yeah, I basically learned off a friend. He taught me how to do it. It was on the job. There was no theory, just like monkey see, monkey do.
Mm.
So that's how we learned. But then afterwards, we went and learned from a lady who pioneered the whole hijama holistic Islamic kind of practices movement in the country. So we were students of her, and then so that was like that. So at 16, that's around 93. So I'm now fast forwarding to like 2004 where we did this. By 2005, we kind of graduated. It was a full-time course, was about 2 years, and full-time was a 1 year course, 1.5 year course, and part-time was 2 years. Did it part-time because I was obviously working, whereas my wife, she was just solely doing that. So we grew like a massive a client base across the UK and further afield.
Mm.
And then at the same time, I started looking into like shiatsu. I started doing medical acupuncture, but always something was missing. Fast forward, then I did training with the Eliteosteo, also by the name Osman. Yeah. So I specifically went to him because I had piriformis syndrome, so I knew what it was, but I knew the modalities I had at that time wouldn't be able to deal with it sufficiently. So I went to him, and
Was that because piriformis is very deep? It's a very deep muscle.
it's that as well. And plus, we've spoke about this many times before. A lot of therapists can't actually deal with real world issues.
Mm.
So I went to him. I didn't know you could deal with it because if I just rewind back a bit, we were already sending. So when I used to do like the anima, the shiatsu, and all the deep tissue work, when people came with specific problems like with sciatica due to disc bulges, disc herniations, bone spurs, or piriformis, me and my wife used to send them straight to Osman because we didn't want to play around with people and say, okay, let's just try. I don't experiment with people, so we sent them straight to Osman.
Yeah, you refer them.
Yeah, I referred him. So this was happening for a good 3 or 4 years. But then I became his patient when I had piriformis myself.
Yeah.
I went to him, and pretty much 80% of it he kind of
got rid of,
and the rest of it I actually did myself. Well, actually, I tell a lie, not myself. My wife, she did treatments for me. So she got rid of like whatever leftover was. So when Osman announced he was doing his CASA method, so I jumped on it. And like
Were you one of the first?
yes, I was the first group, so it's known as the pilot. It's a pilot group, the pilot course.
Right.
Like so we were a group about, I think if I remember correctly, between 8 to 10 of us, and we were the first. And then after that, consequently, he did more classes. Like it's a very it's a good system when you like if you've got like prior knowledge experience. That's what I personally believe.
Yeah.
Like you can come into it like
Fresh.
fresh, but like anything, if you've got experience, you always be better at it.
Of course.
Like no, it's a very simple system, but I always say simplest things are the hardest things to do.
Absolutely,
Even in our merit system, what we are doing, our hybrid system, is very simple, but the simplest things are the hardest things to do.
Yeah.
And I always talk about a famous sculptor, a Japanese sculptor. His name was he was known as Hamada. So he used to make these pots in the 50s and 60s. And so like you have many tourists come and visit his workshop, and then you just see him on his turnstile, and you had this pot going past. You pick up a paintbrush and just do a line across the spinning, like on his spinning turnstile pot, and those pots in those days would fetch for 120,000, 60,000. So
because of his technique.
Yeah, it was his technique. But it's interesting. One day there was some Americans with it, and so the American asked, "Look, it only takes you 1/5 of a second to do that, and you're charging 120 a pot. How do you justify that?" And he said, "Yes, you're right. It takes me 120 seconds to do that, but it took me a whole lifetime learning how to do that." So manual therapy is not different. So you
absolutely
like so you have to develop. You need to develop like a touch sensitivity. You know what? When your palpatory skills have to be very good, and that takes time. And not just time, but you need someone to guide you properly how to do that. So when someone comes into clinic, so using all your senses, you're using your sight, you're using your touch, like and then obviously you're going to be doing like you'll be doing like the assessments, which you see me do and stuff. Like
I think I had a client come in the other day, and he was showing some sort of signs for his SI joint being locked.
Yeah.
Right. So which I quickly called you over, and I was like, bro, do you mind just checking this guy's SI joint? Because what he's saying kind of sounds like it might be locked. You come over, you've done the test with me, and straight away you was just like, oh no, disc issue.
Yeah.
How do you come to that conclusion so quickly? Is it using all of those senses and that experience?
Yes, that's right. It's using all those senses, using those experiences. And again, I always mention that my teachers who I learned from, and I always had great teachers. Yeah. So, for example, even from my earlier teachers, all the way leading up to Osman, they're really good teachers. So I've got guidance from. No, you always need to be mentored. So this is the whole thing is about. You know what you're talking about like earlier. So you need to be mentored. So I've been fortunate enough to be mentored by the best. And I don't say this from a form of arrogance or pride. I'm actually saying exactly what it is. So when I had all my martial arts teachers, they were one set drop down from the founder. So when I had my healing teachers, they were one set down from, or two sets down from the founder. So it's a very close chain. If you follow my chain, it's the founder, my mentors and me. It's such a close chain. But when you have a longer chain, it all gets diluted. So I was very lucky to have that, not to have the right guidance, because that's very important. The right guidance. So I definitely had that. And also I'm like I said, I've got this kind of rashes kind of personality where it could be to do with my ADHD or something, where I really want to go a step further. So even when Osman taught me, all he taught me, I went further, I'll like you see me as well. Like sometimes people when lurking in the clinics, I'll be sitting at 3 a.m. in the morning just going through texts and stuff, and I'll be talking to myriad of people, like I'm talking to spinal surgeons, I'm talking, and these are not easy people to talk to because these guys are running businesses and stuff. They're medical professionals, but because I'll be fortunate enough again to have like these exchanges where you're always learning. So so I always say that you need to be guided. It's not something we can wake up one day and just say. Even if you've gone and done a degree, or even if you've gone on these courses, you can't just wake up and now I'm going to be getting these results, because you need to be guidance, and you need the guidance and be guided.
Absolutely, and I think you need the guidance one-to-one or close enough.
That's right. Yeah.
The results that we get.
Yeah.
There's thousands of other people that graduate from universities every year: physios, chiros, osteos, a whole bunch, right? Why do you think that they're not getting the same results? Do you think it's because they've not had those mentors that are doing it one-to-one? Do you think it's because they've come out the degree thinking, oh gosh, I need to get straight into work, like there's no more space to learn the real world? Do you think it's a bit of both?
I think it's a bit of both, but also it's to do with a lot of these approaches are very dogmatic. So we'll say, for example, in osteopathy, you'll say the founder said such and such, so we're going to stick to such and such, even though you know in your practice that this doesn't work. But we're doing it because the founder did
Founder
it.
said so.
Like all my teachers were against this. Even my martial arts teachers, they said, "You do what works in the real world, not what someone said." 1800s. So
Yeah.
if you look at like MRI, they will show me the MRI disc or MRI space, and they'll say, "Oh, on this it says I've got degenerative disc, I've got this and this," and I think that's to do with my pain. And I'm saying, look, I'm not treating this
Sheet of paper.
this sheet of paper or what's saying on this disc. I'm treating you as a patient who's walked in on this day and what symptoms you're presenting, and when I've done the assessments, what you're doing, and then I'm tackling that in the real world. Because sometimes, for example, let me just give an example. You could have like a bulging disc, but bulging disc doesn't signify why you've got a certain issue going on. So you've got to get to the root problem.
We ask, why don't we get into, say, most recent, what about comical, like a funny treatment that you've had most recently, would you say? Where something interesting has happened or something?
I mean, funny for the case where I had this client come in, and he came in for lower back pain and sciatica.
Yeah.
So we generally did a general quick consult. So my consult don't take like 25 minutes. It's generally, just it's very brief.
Mine too.
Yeah, and you get that
5-10 minutes, right?
and you get straight into the treatment.
Yeah.
So when I was speaking to him, I said to him, "Oh, but were you giving any aftercare, or how you're dealing with it? How you, after you had your last treatment of your last chiropractor, how do you go forward?" And he said to me, "Oh, the clinic's too low. The ceiling's too low, and I can't show you aftercare."
I remember this one.
So I was like, okay. So we stepped outside, like where the matted area is, and so I said, "Yeah, you can show me now. Is this?"
So he was saying that your clinic room was too low.
Yeah, because he wanted
to show you what he'd been doing for his
sciatica, which was given to him by this chiropractor.
Right.
So
because the ceiling was higher.
That's right. Yeah.
Right.
So he proceeded to show me what he did. So I said to him, "Okay, show me," and then he started circling his arms.
Circling his arms how?
Like just doing not just circles with his arms,
like swimming motion.
Yeah. And I thought, okay, that's fine, whatever. Standing up, yeah. So I go, okay, that's great. So what did he show you for your sciatica? And he goes, "Oh, this is to do with my sciatica." And I was like, "But you're circling your shoulder and your arm." And then he was, the poor guy, then he was like, "No, but," he goes, "this therapist told me everything's connected." And I go, "Everything is connected, but like your toes connected to your foot. So what has that got to do with whatever issue you're having, so that was a funny kind of instant. And I'm seeing this a lot, where people are going to these therapists, and again, it's controversial what I'm saying, but it's like the therapist doesn't want them to get better because they're giving you nonsense, like they're giving you stuff which is not going to help you. My whole philosophy is when any client comes to me is to get you the absolute best possible result on the day.
Yeah.
To send you away with bespoke, like aftercare, not cookie cut, which one size fits all, just specific to you, specific to your like lifestyle. Are you a person who goes to the gym? Are you don't go to the gym? Depending on your dietary habits and stuff. So
absolutely,
it's very specific to you. Also,
lifestyle plays a massive role in the type of aftercare you have to give, and also what stage of the injury the client's at.
That's right. And also, the biggest part, and I think it's a very important part, is that I'm educating the person. That like I'm actually like by the time we finish the session, like I would have got him the absolute best possible result on the day, but I've empowered him. That he doesn't need to rely on me to come for another 20 sessions to do the same issue. Yes, a few clients will come back, not because they enjoy the treatment, and now we've helped them with whatever issue they came with. They'll say, "You know what, this treatment's great."
Absolutely.
So I'm coming back for more treatments. That's totally up to the individual. Absolutely. Because they want to invest in their health. But from my perspective and from my side, like my job role is to get you the best possible result on the day, absolute best possible result on the day, give you the bespoke aftercare, and educate you. Or another better word is to inform you, get you informed. So I've empowered you, so you don't think, "Oh no, if I bend down to pick up my pencil, my back's gonna go again."
Yeah.
Or I can't go and put this plate up on the shelf because I've got this range of motion back, but I'm scared if I go, it might lock out again, Absolutely.
So what we do is show the clients exactly what they can and can't do.
That's right.
So that they've got, as much of their life back as they can have, right? When you were first starting out doing what you do in present day, what was the first sort of modalities that you looked at?
I mean, there's quite like a myriad of modalities. Like I started with a Moshe Feldenkrais with the Feldenkrais method. Like he was this Ukrainian, like a Jewish person who had his own methodology, and the whole thing was about movement. And I'm big on this thing about movement, getting people moving, not just bench pressing or deadlifting, which are important exercises, but it's about holistically moving. So I looked at that Ida Rolfman, who was speaking about stuff like the fascia, myofascia, long before
My
like
first champion.
anyone else did before it came flavor of the month. But she was ignored because being a lady, you know, in that
Era.
space era, you know, no one thought, oh, it's just lady. What does she know? But she
Yeah.
actually knew a lot.
Yeah.
You know, so I looked at those sort of modalities. I looked at like trigger points and meridian lines, and you know, like I always say, no, I was very fortunate. I always like no keep talking about my mentors. I had mentors who were like one is still is, you know, he's like two of them are like trauma surgeons. So no, one's at St. Thomas's, one is in Chicago. You know, I think he's at Chicago still when I last time I spoke to him. So they're trauma surgeons. So I was getting best of the both worlds from Western medicine point of view, and also I had teachers who were adapting Chinese medicines.
Yeah.
Two of my teachers so one of them was a Western medicine trauma surgeon, and also a traditional Chinese medicine, and he's still alive. And another one prior to that, he obviously passed away. But yeah, so I think I had the best of both worlds. So you know, like so when I look at any modality, I'm looking through eyes from, you know, like, you know, you understand, you can't look at something and think, oh, well, this looks rubbish. What does that mean?
Absolutely. Yeah.
Like, so, like, you know, so like again, I always go back to my mentors, because I know we say, no, we can look ahead, we can forge ahead, because we stand on shoulders of greatness who come before us, meaning our mentors.
And talking on mentors, you're one of my mentors, and a big question I get from clients a lot is about dry needling. Dry needling. Lots and lots of practitioners do it. You used to do it.
That's right, yeah.
Right?
And
You've got a lot of experience.
Yeah, I've got a lot of experience in, like, yeah, that's right, in dry needling and medical acupuncture.
Yeah.
The reason I stopped using that modality was because, firstly, it's very dependent on how recipient a person's body is. Which, if you're selling this as a like a form of where someone's paying you and you're as a form of treatment, that how ridiculous is that going to be? If your body accepts this, you'd be good. And that's why I used to have a large amount of clients who felt so imagine they're pain in the trap. I'll go and do some dry needling, medical acupuncture. It gets worse.
Really?
Yeah. So this is so again, I've got like a whole years and years of collection of. I always keep records of clients on what he came and what he did. So I've got many. So that's the reason because I can't have you leaving in more pain.
Absolutely.
Because one, you're paying. I wasted your money. I wasted your time. You know.
Yeah.
So that's one of the reasons I stopped. For some people, it works like magic. You know, you put the needles in, within minutes, the issue's gone.
Yeah, for a small percentage, right?
A very small percentage. You know, this is my experience. You know, like so that's why I don't. Like, for example, I find like hijama works much better than that.
Yeah.
And a lot of the clients who I get who I had from when I was doing strictly just hijama by itself, they used to say that, oh no, we tried. You always ask me what other treatment you tried, and he said, oh, I tried dry needling, I tried acupuncture, like, you know, moxibustion and stuff. How did it help you?
Didn't.
Because if it helped you, guess what? I still be doing it because I'm qualified to do it.
Yeah.
Actually, that actually did training here in the UK and also in Kobe. That's Japan, and also like very briefly, probably about 10 days or so in China. But in Japan, I did that a lot longer.
Yeah.
And if those modalities were be all end all, that's what I'll be doing.
Exactly. And you know, I think we both are super big on doing what works.
That's right, yeah.
Not what we're qualified to do just because we can do it and earn a bit of extra money doing it, right? It's not about that. It's about what works and what is likely to work.
And help the person. Yeah, that's right. Yeah, because it's not about how many, like, I've got these 6 hacks and I've got these 6 skills and these 6 skills. I want to do every 6 skills for you. But you know, because it's, like I said, our treatments are very bespoke on what the person needs.
Which is exactly what we'll be teaching in the hybrid system, right?
Right, that's right, yeah.
Exactly when to do said modalities, because they work in X scenario and maybe not in Y, right? And this can take years and years and years and years to learn, and which is why I've progressed super fast, right?
Yeah, that's right.
I only started about, 2 years ago in this industry. And that 2 years ago, I was just doing regular massage. I only started to work in injuries, sports side of things, maybe close to a year ago.
Yeah,
right?
I mean that's right.
I've progressed so fast because I've had you to tell me exactly what to do, what not to do.
Yeah, I mean it's true. It's like you definitely need to have mentors, you know, like, and people who don't gatekeep. And I've been lucky; none of my mentors gatekeeped. So and I didn't gatekeep with you. And
what exactly do you mean by gatekeep?
Like, if I know, like, for example, don't used to ask me, oh, don't this person's got X, Y, and Z.
Yeah. And
I'll tell you it's because I think it's because of this, this, and this. I wouldn't just send you down a path and say, oh yeah, why don't you try rubbing his foot or rubbing his elbow? You know, like that'll get fully well knowing that's not going to help you.
Yeah.
So that's what I mean when I'm saying gatekeeping. When people don't want to, people see everyone as competitors.
Yeah.
Don't get me wrong, I do see other people as competitors, but
sure,
I was just talking board and didn't see you as a competitor, you know, like,
Yeah.
you know, like you're saying, like, you know, I'm actually an older man now, you know, like, so, you know,
Yeah,
same
yeah,
age as my, you know, your same age as my oldest, like, son, you know, like, so I never saw you as a threat. So, you know,
yeah,
but like, and again, you know, like, people always ask me, you know, like, and I'm big on integrity, you know, I don't like lying, you know, like,
yeah,
so when people ask me how long you've been doing something, so sometimes I say to them, I've been 19 years, and this whole thing start, we only look 35.
yeah.
Like, how can you be doing for 9 years? And
I get that all the
I
time.
say, I'm not 35 yet. I'm actually a lot older,
Yeah,
like probably getting close to 50. You know, like,
yeah,
and another thing is, I mean, some people take it as a compliment, but for
yeah,
me,
yeah,
integrity is a big thing. Like I said, I've been learning since the age of 16, and I got into. But I always say 19 years because it was, well, obviously, if I take it back to 16, it's longer than 19. But officially started doing paid, like, treatments from end of mid 2004, end of 2000, 2005. That's why I say 19 years.
yeah,
But I'm not saying I did 19 years of the CASA method. I'm not saying I did 19 years of hijama. I'm not saying I did 19 years of, you know, like,
yeah,
I'm talking about the whole scope of
yeah,
things, because what that what makes you as a person.
yeah.
Like, you know, like,
Just working with the body and healing in
that's right, yeah,
general.
yeah.
Yeah,
And building those, like, touch sensitivity skills, the skills of touch, the skills of listening. No, you're using all the senses, the
yeah,
skill of, 'cause you've got to be able to listen to what the person's telling you. If you go to a lot of therapists, I mean myself, when I wasn't a therapist, when I got injured from doing a lot of grappling, doing a lot of martial arts, I got injured. I'm going there telling the person where the pain is, and the guy's trying to tell me, no, the pain's in your hip.
mm.
And I'm saying, no, it's not, because I got strangled last
I
night.
get that so
The
often.
pain's in my bloody,
I get that
it's
so
in my
often.
cervical region, meaning the neck region, you know? So, like,
Yeah,
so yeah, so I'm big on integrity. Like, and everything I've said today, it's all checked. I've got videos going back
yeah,
from when I was in the classes at 16-year-old doing teaching. I was at 16-year-old, when I mean, learning, teaching, like, martial arts,
yeah,
learning the Chuna. I'm talking about the wild goose qigong and stuff. So everything for me is evidence based on my side, meaning evidence based when I'm talking about from the sense that where I've been, what I did.
yeah.
Like, there's nothing where I'm just giving you some kind of nonsense.
Nonsense
Because,
story.
like, so sometimes it annoys me. Some people say to me, oh, like, for example, you couldn't have done it more than 19 years. Are you saying you've done it more than, for example, such and such person? I'm saying, no, of course I haven't done. For example, I haven't done Casimir for longer than bloody
Himself.
Usman,
Yeah,
because he's the one that bloody taught me. So why
that's
the
right.
hell would I even go and say I've done it? But what you're asking me, you know, you got to be specific what you're asking me, and I'll give you. If you're saying to me, how long have you been in this industry? Or how long have you been in this? I'm gonna tell you 19 years, because I have.
Mm.
I'm
Yeah,
not saying I've been 19 years in bloody Casper, because Casper has not been around for 19
19
years.
years. Yeah,
Or I'm not saying I've been in. I was in 19 years of doing medical acupuncture,
yeah.
but I was doing a good, like, 5 or 6 years. So yeah, so integrity is a big thing.
Yeah. Don't you think that's a massive thing that plagues other therapists as well? You just touched on the fact that you're one of the old people that you treated or that treated you. You'd say your pain is in your knee, let's say, and they say, "Oh no, but it's actually coming from the neck." Don't you
Yeah,
think that's? Don't you hear that in clinics so often? I do all the time,
yeah.
every day. Oh, I went to this practitioner or that practitioner. I went for this massage, whatever, and they just wasn't listening to me.
That's right, and that's what. If you remember, that's what I taught you. No, this thing is a big skill. You have to have use that sense of listening, and, like, no, because you can be. Do, like I always say, you're looking without seeing,
Mm,
you're listening without hearing.
mm.
If you remember, I've told you that many times.
Yeah, yeah, yeah,
So we as practitioners, if you're looking and you're not seeing, you're not looking. You know,
yeah.
if you're listening but you're not hearing, you're not really listening. You know, because
That's right.
so
Yeah.
if someone's telling me that I've got a pain in such and such, they're giving me this big chunk of information. Okay, sometimes obviously, you know, like, emotions play. So someone tell you I fell off my bike when I was 7 years old, and I think I got that back pain from that time.
Mm,
I'm not saying it isn't, but generally it would be other factors leading up to that. Like,
absolutely.
it wouldn't just be because a 5-year-old you fell off a bike and now you got backache and now you're getting sciatica, for example.
Mm, mm,
Many things. No, it's like I always say, it's the last straw that broke the camel's back. So it'd be a myriad of things that build up to that. I know if you've got like a piece of chewing gum, you can stretch it, but eventually it will break or snap.
yeah.
So that what usually happens in the body. You know, it will just, so, like, you know, yeah,
Another super interesting story I remember you told me is that you used to treat army veterans
yeah, yeah,
at some point, and this is part of how you got good at treating sciatica, right? Because, and this really boggled my mind because because you used to say that some of them would have no legs. How can someone
yeah,
with
yeah.
no legs have pain going down
Yeah,
their
you have phantom pain.
legs?
Yeah, and so what it was, I didn't have, like, what I say at that point was I was treating, like, sciatica, but I wasn't getting great results.
Right.
One, because I ain't got no legs, you know, it's phantom
Sure.
pain. But secondly, because I needed that information, and that information I got from Usman.
Right.
because he's the industry
Sure.
leader when it comes to treating sciatica.
Yeah.
So by the time at that time, again, I'm big on integrity. At that time, I didn't have the right skill set.
Sure.
So that skill set I got later on with,
Sure.
with like a. But what the way I was doing those treatments was from the knowledge I had, and it did help him.
Yeah.
But it's nothing to what I am now,
Sure.
and that's again is thanks to what I did with
Usman.
Usman. Yeah. So you got to give credit where credit's due. You can't
Of
just
course, no.
you can't just say, oh no, yeah,
I learned that by myself.
yeah, I learned it myself. One day I woke up and I sat on top of a mountain and the knowledge was bestowed on me. No, that didn't happen. You know, like
Yeah.
someone physically taught me, and and I'm always grateful for that. You know,
Absolutely. Yeah.
I wanted to ask you, what's your favorite kind of say like when a person turns up, what's your favorite kind of condition or symptoms or or
To deal with.
presentations, what to deal with? Yeah.
Yeah. I would say my favorite thing to deal with is probably upper back and neck pain. I would say that because I have really good feedback from my clients who have that sort of thing. And to be honest, it's probably also because it's the thing I've done the most,
Oh yeah.
right? I think it's when you treat something day in, day out,
Yeah,
it's the
right.
thing you
That's
treat
right,
the most, you're getting good at it. All of these factors come together and it's the thing you enjoy the most eventually, right?
Yeah. Also, so you get good results with the full body reset you do.
I try to touch on a few different specific areas in my treatment. So I'll try to touch on, often people come in and say, I've got pain here in this shoulder, this lower back, and this ankle, let's say, right? And though you may not get results in all of them, of course, I try my best to get results in all areas and cover as much as we can, right? My treatments, I've just recently added a treatment that is 2 hours long, right? So we can cover extra stuff.
Oh, yeah.
But even so, for example, I might get a great result in the lower back and the shoulder, but for example, the ankle is very difficult to treat because there's not a lot of soft tissue there.
Right.
It's mainly ligaments, harder structures,
Yeah.
right? So in that case, and coming back to what we were saying earlier about the hybrid system, teaching many different things, and what you were saying about empowering the client and telling them exactly what they can and can't do for said stuff, right? So, for example, I might get great result here, but not have maybe enough time, maybe not have the right resources, maybe it not be possible to treat the ankle properly, right? So for the ankle, then it's about getting them off the table, out onto the gym floor, showing them exactly what they can and can't do, how they can manage the pain, how they can get through their day-to-day life with said discomfort, even if I can't treat it properly, right? Which is
That's very important. Yeah,
because
that's right. Yeah, it's
it's
very important to
important.
teach. Yeah. Important to tell the clients what you should be doing and what you shouldn't be doing, because some things
Absolutely.
that you shouldn't be, some things that you might be doing might be agitating the actual condition.
Yeah,
So that's empowering them again. With what,
absolutely. And I think, that in terms of the hybrid system covering all areas, I think that's something that, hopefully will make it quite popular,
Yep.
right? Because, at the moment, people are going to, let's say, chiro for joint type issues, right? They're going to an osteo for maybe a more holistic approach to their pain, right? They're going to the physio for their exercises
right, yeah.
and stuff like that.
So
Stuff
we're,
like
we're
that.
kind of one stop for
All of them,
all of them. Yeah.
right? And, I kind of take it as taking the best bits from all of them, right? Because obviously, e- e- every practitioner, every sort of modality is going to have its best bits, because they're taught a framework, right? An old framework, like you said,
Dogmatic frame.
dogmatic framework, right? Some of the things in that framework, as you probably know, don't work, as you said earlier, right? So it's about picking the stuff carefully that works, and then putting all the different putting all those different bits into the treatment to make it as good as possible.